Monsieur Wave.
Yo, apply. Yo, luta do de. Luta mo nulo jël moto nga andil ma xaalis. Hello?
Bësal mu fay.
What?
Bësal mu fine.
Oh, yes!
Wave acts in Gambia. Deposit and withdraw money, pay bills, and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Bësal mu fine. Wave, your money is yours.
Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
It's Tuesday, the 8th of April, 2025, and live on West Coast Radio, it's Coffee Time with Peter Gomez. Now, health tops the bill today, with close to 300,000 women set to continue to die during pregnancy or childbirth each year. More than 2 million babies die in their first month of life, and around 2 million more are stillborn, says the World Health Organization, WHO, which on the occasion of World Health Day yesterday, April the 7th, has kicked off a year-long campaign on maternal and newborn health. The Healthy Beginnings, Hopeful Futures campaign is asking governments and health policymakers to ramp up efforts to end preventable maternal and newborn deaths and prioritize women's longer-term health and well-being. Through a series of strategic actions, WHO aims to not only save lives, but ensure both mothers and infants thrive. Now, one of those strategic actions by WHO in the Gambia is to begin the day today on radio to bring attention to a health topic of concern to Gambians in and outside the country. In that regard, I'm glad to welcome Dr. Nathan Nsubuga Bacita, the new WHO country representative in the Gambia. He's going to be with us for the next 15 minutes. First, I am told reading out a statement to commemorate World Health Day, and then take a few minutes to answer a few questions. Dr. Nathan, welcome to West Coast Radio.
Thank you very much. I'm glad to be here.
In fact, I should say welcome to the Gambia because you're pretty new here.
Thank you.
How long have you been here for?
I've been here for approximately 2.5 months.
And how have you found it already?
Well, it's becoming home because it's going to be my home for quite some time, so I'm making it home.
Fantastic. Weather-wise, how have you found it?
Well, I'm told this is the cool weather time, so it's similar to where I come from, but I'm told that when the weather gets a little hotter, it will be different, but so far, so good.
Well, I'm glad that's the attitude. And when you say where I come from, where do you come from?
I come from Uganda, but I've been working in Zambia, and now I'm in the Gambia.
You see, a country we've been confused with for years and years.
Exactly.
Very good. Welcome again. And as I said, you have a statement to read first, and then, we see what questions we might have for you.
So thank you so much for this opportunity. So on this World Health Day, we stand under the theme, Healthy Beginnings and Hopeful Futures. We celebrate the promise that every Gambian mother and child deserves a safe start in life. Yet, we must ask ourselves, are we doing enough? World Health Day is celebrated annually on April 7th to mark the founding of the World Health Organization in 1948. The day aims to raise awareness about global health issues and encourages actions to improve health outcomes worldwide. Each year, World Health Day focuses on a specific health theme of major importance to global health. For this year, the theme is Healthy Beginnings and Hopeful Futures, which emphasizes ending preventable maternal and newborn deaths and improving women's well-being. In the Gambia, too many mothers still face childbirth in fear rather than in hope. Too many newborns never take their first breath. Too many families mourn lives that could have been saved. A mother in a rural village should not have to wonder if a skilled doctor will be there when she needs one. A father should not have to pray that the clinic will have medicine for his sick child. A baby should not have to fight for the very first breath of life.
Fantastic. It's a strong statement. What must Africa do to overcome these challenges? Because these are challenges the Gambia only, doesn't face. Other countries across the continent face similar challenges, of course, at varying degrees.
Yes, so this is a problem that is widespread, especially in sub-Saharan Africa, where we have unacceptable numbers of preventable deaths among women coming to give birth and children. But one of the first things we need to do, all of us, is to try and accept that we have a problem, try to understand the problem, what are the issues that are leading to this particular situation, and come up with solutions that are tailored to the local context. Although most of the maternal deaths and neonatal deaths occur in sub-Saharan Africa, but the contexts are different depending upon where you are. So understanding our context within the Gambia is extremely important. So as WHO, the UN family, and indeed many other partners, part of the work we do is to make sure that we help or support governments to come up with the information that will help them realize what the problem is, so that the solutions that come up are tailored to the need or to the particular context. So as a result of that, or in order to make that happen, WHO and other UN agents have come up with strategies. For example, we have the Global Strategy for Women's, Children's and Adolescents' Health, which puts together all this information about what is happening and what needs to be done. We have a maternal and neonatal child health strategy, realizing the problem was more among that group, 2021-2025. We are also concerned about the quality of care people receive, because it's one thing to make contact with the health system, and it's quite another to get the service, but also is the service of a good quality to make sure that the outcome is good. Then there's been the move for universal health coverage, working through a primary health care approach, where we make sure, where we are emphasizing that people should be able to have access to the care they need, when they need it, where they need it, and at a cost that will not drive them back into poverty. So that's universal health coverage. And most importantly also is to make sure that we keep collecting information about what is happening, so that we know where the real problems are, and also learn from them, so that we design even better services. Mm-hmm. So that's the space where we need to work. Mm-hmm.
Well, listen, all this call to action isn't new. It's been there for decades. Earlier on, you spoke about, different contexts across the continent, but one common denominator has to be probably political will. Do you always find in countries you have worked that there is the political will to really advance, health?
I think political will is extremely important, and across this continent, I think we've done a good job in raising political will. By saying we, not just the UN, but all governments. You find that for many countries that I've worked in that I'm experienced with, you find that the first ladies of those particular countries tend to be the champions for reproductive, maternal, and child health.
It mirrors, it mirrors the situation here in the Gambia. The first lady,
exactly. So they always spearhead that work. So the political will is there. But beyond political will, we need to make the critical investments, financial investments, technical, making sure that you build the capacity of the health workers to be able to do what they are supposed to do, the infrastructure that is necessary for that, making sure that the medicines are available, the equipment is available. You need to also make sure that beyond just the political support, the community is supporting this work. Because as we know, some of the barriers to safe deliveries could be in our cultural practices. the way, if we're in a patriarchal society, the husband must give permission before you go, or you have other cultural practices and make sure that perhaps people don't get access to care in time. So we need to look at the whole multifaceted, it's a multifaceted problem that requires a multi-sectoral approach to be able to do that. But political will is key in spearheading that.
Later on, I'll be talking to the governor of our central bank, and he'll be talking about Donald Trump and how his actions, thousands of kilometers away, will have a devastating impact on the Gambian economy. The United States has withdrawn under his leadership from the World Health Organization. How will that affect the WHO?
Well, we got that information that the U.S. will be withdrawing from the WHO. It was devastating, of course, because the United States government has been a member of WHO, has contributed a lot to our initiatives, but most importantly has been making financial contributions. So what is happening at the moment is that WHO is working together with internally, first of all, to see how we can cope with this new reality, to see where we can bring in cost efficiencies to handle that, but also to try and continue negotiating and seeing whether this is something that can be reconsidered.
And at regional level, I mean, what must African countries do? We have the WHO, regional office for Africa.
I think the African nations, what needs to happen within WHO, we've looked at austerity measures to see that our funding may not be like we had expected. Where can we gain efficiencies? How can we do that? But the details will come back later. But it also raises the issue that for us as African nations, we need to improve our domestic financing to the health sector. For a long time, some of the services that we as governments should be provided have been funded by other people. But now the reality hits us, and it means that we need to, in spite of the economic situations we find ourselves in, we need to improve domestic financing and eventually depend on our own financing to handle these services.
So every year we celebrate April the 7th as World Health Day, but this year it's World Health Year. So what are some of the activities lined up?
So there are a lot of activities. A lot of it will be advocacy, advocating for more critical attention to maternal and child health. There will be activities for mentoring their providers, because we know that one of the reasons we lose some of our mothers is inadequate access to emergency, obstetric and neonatal care. So there will be quite a lot of mentoring on that, and also other activities to make sure that the community knows about the importance of this and the things that they can do. It is evolving with time, and will be informing you of further activities throughout the year.
And finally, the theme this year focuses on women. Apart from having you, a man, being the country representative of the WHO in the Gambia, what role do men have in this year's celebration?
Men have a very critical role in making sure that we have healthy beginnings. For example, in a family, you have a husband and the wife. So the husband and the wife need to plan to have that child. The husband plays a role.
They have to plan to have that child.
They have that child, let's put it that way. They plan or they have that child, whichever way you look at it. Number two, have to look after the wife properly, making sure that she is in good health, good nutrition, has to support the wife to attend antenatal care, all the 4 to 8 visits that are recommended right now. If you can, we approach that. Provide the financial resources to transport the wife, for example, from home to these services and so on. Be present when the wife delivers and be ready to look after her afterwards.
And what if there are cultural barriers? Some would say even religious barriers. There are some who say, well, as a man, my religion, my culture prevents me from being there when my wife is delivering.
Well, those are conversations that we need to have with our religious leaders, with our traditional leaders, and the gatekeepers in society, and say, yes, we may have these cultural barriers, but is there a way we can mitigate against them and make sure that we are more supportive of our women when they go to deliver. I think it's a dialogue that really needs to happen continuously.
Absolutely. And just finally, what message might you have, just to wrap up this conversation?
The message I have to wrap up this conversation is this. Let's imagine a future where every mother and child survive. It's up to us to create that future. Together, let's make healthy beginnings a reality. Let's build hopeful futures for every mother, for every child, and for the Gambia. WHO Gambia stands with you and will not stop until no mother fears childbirth and every child has a chance to thrive.
Fantastic. Dr. Nathan Nsuguba Bacita. Am I saying your name
Soguba Bacita, that's fine.
Soguba.
Yeah.
Soguba Bacita. Thank you so very much for your time this morning.
Thank you for having me.
That was the country representative of the World Health Organization in the Gambia.
Jar Oil, the company, have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Excellent jam, Wave.
Yo, apply. Yo, luta do de. Luta mënulo jël moto nga andil ma xaalis. Hello?
Bisul mu fine.
What?
Bisul mu fine.
Oh, yes!
Wave Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Basel Mufine, Wave, your money is yours.